what are some of the most pressing health issues facing our world today? In 2014, we were talking a lot about the Ebola epidemic. Is there anything in that magnitude that is concerning you this year?
The world is facing major challenges today in health issues, and Ebola is just one of them. There are multiple issues related to infections, infection control, resistance to multiple drugs and antibiotics that we use to control that we use to control infections and viruses, and as well as issues related to global health problems related to migration of people around the world.
So the refugee migrant crisis that we have seen, clearly it has triggered a massive humanitarian crisis. Are you concerned about the health crisis it can create?
Absolutely. I'm very concerned about that because people migrating from Middle East to Europe and elsewhere in the world are bringing diseases that are not well known to physicians in European countries, Western countries, and other countries that accept refugees. Also, lack of normal practices of quarantine and basic physical examinations and evaluation of these people will create, and it's just a matter of time, a health hazard to the population around the world, because these people bringing the diseases with them, and some of these diseases are not well known to the physicians around the planet.
So what are some of those diseases?
Well, one of the most striking disease that is very well known and widely spread around the world in the Eastern countries, Middle East, and Southeast Asia is hepatitis. And as a liver surgeon and liver specialist, this is something that I deal with on a regular basis. And just to give you an idea of hepatitis numbers, it's 2 billion people have been infected in their lifetime with hepatitis. 350 million people worldwide carry the disease in active or chronic state, which will create eventually liver failure and liver cancer. This is a worldwide problem that we're facing. And outside of very few efforts, which are extremely uncoordinated by world's governments, very little is done to control this epidemic.
So what about vaccinations? Does that help the situation any?
In the United States, vaccination for hepatitis B has been implemented for many years. And the new generation, especially the generation of millennials, will never face hepatitis B infection for those who were born in the United States. But even today, with continuous immigration in the US, we're still facing many, many people who are infected with hepatitis B. The other enormous problem worldwide is hepatitis C virus, which is a completely different disease. Now we have a medication to treat that, which was approved very recently. It's called Sovaldi or Havroni. But the problem is in the United States, this medication costs $85,000 to $90,000 for 12 weeks of treatment. And very few patients in the US can afford it, let alone people living in other countries.
Dr. Alden, before I let you go, I want to get back to the Ebola outbreak. Do you believe West Africa is out of the woods?
Well, I think Ebola outbreak was very complex, very dangerous, and I think the world was very lucky to control the epidemic in a very good way. But I don't think it's over. I think because it's a type of disease that will mutate, will change its way, and will change its face, we will face it again in the future.
All right, Dr. Dmitri Alden, thank you so much, sir, for your time.
Thank you for having me.